We're a fairly large homeless service organization. We have a number of shelters. We have about 800 units, a little over 800 units of permanent supportive housing, and we're also a licensed mental health treatment organization and a licensed drug alcohol treatment. The homeless most people mention the homeless as though they were this homogenous group of people, and they're actually as heterogeneous as all the rest of us. And they're sort of discrete subsets of homeless families, homeless street youth, homeless veterans. We work with a subset that's known, for better or worse, as chronically homeless people, people that have been homeless for long periods of time, who are also living with major psychiatric disabilities and addictions. We morphed to a model of permanent housing called Housing First, which is predicated on a very simple notion. This population, the people living with major mental illnesses and addictions, have basically failed everywhere. They've failed in housing programs, they've failed in clinical programs, and the organization I work for and several other organizations across the country, Pathways to Housing in New York City, the Colorado Coalition in Denver, LA's Skid Row Housing Trust, leaders in those organizations began to get together, and we thought there was a better way to address this population and the repeated failures that people were experiencing. And the model evolved and now is known as Housing First. Basically, we move people directly from the streets and shelters without any kind of preconditions placed on them other than paying rent and no violence. We don't insist that a person be sober. We don't insist that a person be connected to a clinical provider taking psychoactive medications. We want to move people in off the street, and it's predicated on the idea that if you can eliminate the chaos of homelessness from a person's life, clinical and social stabilization will occur faster and will be far more enduring. So that's, I guess, about the lowest level I could reduce. Housing First projects have opened in Philadelphia. They've opened, obviously, in New York City. They've opened in California. They've opened in Texas. Today, Anchorage, Alaska is opening such a project for late-stage alcoholics. It's an idea that I think has captivated the government's attention, particularly those government agencies that fund programs to address homelessness, because it has a very powerful demonstrated impact in reducing taxpayer-funded use of hospital emergency rooms and jails. Basically, just our personal experience and some of the conceptual stuff. We've started doing technical assistance, and I think we've got about 20 clients now, combinations of not-for-profit providers, but also state government agencies that come to Seattle, take a look at us. They invite key staff in our organizations to go back to their communities, meet with their staff, and depending on where they are, and if they're just thinking about it, we have a sort of syllabus, if you will, that's grandiose. It's not quite a syllabus, but where we help people think through whether or not doing a Housing First project is right for their community. But if they have more mature plans and are right on the verge of opening a project, we also do a lot of training with staff about how to cope with problematic behaviors they're going to encounter when they bring this population inside. Well, yeah, I think most people don't have a whole lot of sympathy for people that are living with addictions. When we opened the 1811 Eastlake project and the run-up to that, I think I was somewhat stunned by this overwhelming desire people in my community have to morally judge an addict as opposed to looking at the addiction as a type of illness or disease. I think we've come miles in reducing the stigma associated with mental illness. I don't misunderstand me. We're not there yet. We've still got miles to go. Sure. but we are much further advanced in reducing stigma associated with mental illness than we are reducing stigma associated with addiction. When we were planning 1811, most of the media coverage of it used it as entertainment fodder. Look what these silly liberal people in Seattle are doing, building a luxury hotel for chronic street drunks, and they're using your tax dollars to do it with. That was the typical way that we were dealt with. It was painful on some personal level, but I think it was much more painful in that kind of coverage does nothing to educate the public that should be educated about addiction and the possibilities even for people that we would think would be hopelessly entwined in the throes of an addiction and nothing can be done for them. That's simply this particular facility for late-stage chronic alcoholics is located on the periphery of downtown. But I could see, and as far as putting it in a residential neighborhood, if that's the thrust of your question, probably not. Okay. But a Housing First project for people living with mental disorders, yes. We have those projects located in very residential neighborhoods in Seattle and have gotten all of the typical opposition comments about threats to our children, threats to our seniors. We're just turning an economic corner. This project is going to deal a death blow to that effort of economic revitalization. It's going to decline all of our property values. It'll increase crime in the neighborhood. None of that comes to pass. There's a lot of empirical research. Right. People living with severe and persistent mental disorders are actually less threatening to strangers than you and I. There's this assumption that homeless people are sexual predators, and it's simply not true. No. In terms of sexual violence to children, the national data is over 90% of sexual violence toward kids is committed by family members or friends of family members, which was a startling statistic to me. I've, in spite of being my age, have a young daughter, and I dawned on me hearing that when she was 3 or 4. When I'm warning her about stranger danger, I'm only insulating her from 10% of the risk of sexual exploitation. There has been a dramatic turnaround because of the article that was published in the Journal of the American Medical Association that demonstrated that the 1811 Eastlake Project in 12 months reduced taxpayer-funded use of emergency departments and jails by over $4 million and had a concomitant 30% reduction in alcohol consumption.